Knock, knock. Hi, Mr. Jones.
Hello.
How are you?
I'm good. I'm cramping.
Well, I'm here to help with that. So I'm Sarah. I'm a student at Mount Valley College.
And I'm Jamie.
Yep, and so we checked the doctor's orders, and you were due for a hair flush, so we're going to go ahead and administer that for you.
That sounds great. This hurts.
Alright, so before we get started, if I can just have you tell me your name and date of birth, please.
Mr. Jones, 7/14/1942.
Great. Alright, so for the procedure, what we do is we roll you onto your left side, and we have a warm bucket of water with the tubing attached that we insert into your rectum, and we just raise the bucket up and down to help relieve the gas.
Sounds great.
Alright, do you have any questions before we go ahead and get started?
No.
Alright, I'm gonna go ahead and set you up then. So what you do is you want to make sure you bring chucks in with you. I brought in two, one for the under the patient, one for the floor. However, you may want more underneath the patient in case it makes a mess, so pick at your discretion. I also have my bucket. In the hospital, they come already pre-lubed, but at the school we don't have it that way, so make sure you bring in your KY jelly as well. Alright. So I'm gonna go ahead and put some gloves on. Well, I guess I'll wait. Alright, so I'm gonna fill the bucket up with warm water. It needs to be 105 degrees. You wanna fill up about 1,000 milliliters. Okay, so then you wanna test it, make sure it's not too hot. So you can go ahead and stick your finger in, pull it out on your forearm. Alright, it's not burning, so it's good to go. Alright, so now that that's all did, I'm gonna go ahead and put my gloves on. I can get them on. Okay, great. You raise the bed up. Did you tell them that?
Hey, you were talking.
Oh, sorry. Jamie, raise the bed up to a working height. You gotta make sure you keep track of your body mechanics so you don't bend over and hurt yourself, because as Snyder always says to us, your back is your paycheck.
Amen.
Alright.
All right, Mr. Jones, what we're going to have you do is lay over on your left side, place your hand on the handlebar, and if you need some help, I'm here to help you.
Okay, I'm good.
So let's cross your neck, or leg.
Alright.
Put your hand right there.
Okay. Now in the practicum, you are allowed to ask your friend to come in and help you, so you don't have to do this all by yourself. You can if you want, but just ask your friend to come in with you if you want someone to help hold the patient up. Alright, so I'm gonna move that. Alright, get your chuck out, put it underneath the patient. Alright, great. Then you wanna put your chuck on the floor for your bucket. Okay.
It is important to note at this point, you want to communicate with your patient that the vagus nerve can be stimulated doing this, and it can cause bradycardia. So you want to make sure that you tell them that if they feel faint or any kind of dizziness, that they immediately communicate that to you.
Alright, so you're gonna go ahead, the bucket is clamped, this one doesn't have one, but they're blue, so just make sure you clamp it with your hand. Okay, you wanna apply your KY jelly 2 to 3 inches onto the end of the tube, then you throw it in the trash. Okay, then you wanna insert this into your patient 3 to 5 inches. Right. So on the mannequins, they don't really go in very far, so make sure during your practicum you just tell your instructor, whoever's checking you off, that it's 3 to 5 inches. And you want to make sure you point it towards the belly button. It's very important to follow the layout of the colon. Okay? How you doing, Mr. Jones?
I'm good.
Alright, we're going to go ahead and get started. So now you want to unclamp, and you want to raise it about 18 inches, so you can just hold your elbow at your hip, relax your arm, and you want to let 200 to 300 milliliters of water flow down. Okay, so we'll just say that's good. We're going to go ahead and drop this to the floor, or as far as you can get it. I have to hold this right now. Okay, so you should have the bubbles come out, because the whole point of this is to relieve the flatulence from the patient, which is gas. Alright, we're going to go ahead and get started again, Mr. Jones.
Okay.
You raise this back up, your 18 inches. And then you might want to make small talk with the patient, because this is kind of an awkward, weird procedure. And a lot of times it makes them feel more comfortable too.
Definitely. Makes you feel more comfortable too.
Yeah, because you are exposing them. Alright, there's our 200 to 300 milliliters. We're going to lower this back down.
Bubble, 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 bubble.
Okay, how are you feeling right now, Mr. Jones?
Oh, I feel so much better. Just a little bit of cramping left.
Alright, we're going to do it one more time then. So, raise it your 18 inches. again. Lower this back down.
Bubble, 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 bubble.
Okay, how are you feeling now, Mr. Jones?
Oh.
Any lightheadedness?
No, that feels so much better.
Great, you're not dizzy at all?
Nope.
Okay, then we're gonna go ahead and get this out of you. So you might want to clamp this since you can't lower this all the way down to the floor. You don't want any more water coming out. Okay, just fell off the bucket. Shh.
That didn't happen.
Yep, that didn't happen. Just pretend. Okay, so now when you're pulling this out of the patient, you want to make sure you don't flick it at yourself because you don't want any of this in your face. Alright. So I wrap my hand around it so I would do that. Then this all goes in the trash. So you throw this away. Alright. And now we're going to go ahead and get rid of these chucks. Now, what I might do with the dry part of the chuck is just wipe the patient off. They need it. They may want to be cleaned, so you might want to have bed bath stuff with you. Alright, you want to go ahead and do that for him. So, and all this goes into the trash again. Alright, so let's go ahead and cut the patient all up. Take our gloves off. Trash again.
Trash on that one.
Alright.
Wash hands.
Okay. Gonna make sure we lower the bed back down.
Brakes on.
Yep, and check. You can bump the bed, make sure it doesn't move. Alright, Mr. Jones, you're all set. Can I get you anything?
No, I'd like my side table close to me so I can reach my cell phone.
Yes, of course. I'll go ahead and move that back for you. So pretend the stuff is not on the bedside table because I threw it away. Alright, can you get to that okay?
Yes, thank you so much.
Alright, great. Well, then we're all set. Have a good one.